Hey, Carolyn, nice to see you again.
Hello, Shayna. It's been a while.
It has, yep. Took a little break and kind of regrouped ourselves a little bit. And I think today we're going to be discussing cardiovascular health and disease.
Yes, gotta love it in February.
hmm
How did we get to the end of February already?
I really don't know. And I don't know about you or where you're at, but it sure feels like spring. And I've got a friend in Denver. She sent me a picture. She's like, we got 14 inches of snow last night
No.
in Denver. Yeah,
Out. Ugh.
wild. Meanwhile, it's like the Florida of Colorado where I'm at, I feel like.
I have a flower that opened and bloomed outside
Oh my gosh.
earlier this week.
Wow. Spring is
So,
upon us, which I am very grateful for, kind of coming out of the cold weather.
yes, very
Okay.
good. So,
Well,
vascular, not just a muscle there in the chest cavity.
mm-hmm.
Has a I actually had a little mini lesson on the heart yesterday, as a matter of
Cool.
fact, and how one thing I thought was really interesting was the theory, and I don't know what you think about this theory, is that, sorry, as women age and we start to lose testosterone and we don't fill up our water bottles,
Yep.
um, that the epithelial lining of the arteries starts to deteriorate.
Mm-hmm. Is that testosterone or estrogen?
It's the loss of estrogen
Estrogen, okay.
that would cause it during
Yeah,
menopause.
after menopause, yeah.
So then I was wondering if women that have I won't say natural, but for whatever reason are starting to produce excessive amounts of testosterone,
Mm-hmm.
what that does.
Yeah. I'm not sure about that on the cardiovascular system. I do know that testosterone can increase like the like heart rate and stuff like that in excessive amounts, but beyond that I definitely know that like women go through perimenopause and menopause, and this is part of the whole thing of like having a complete hysterectomy even earlier in life than what is, again, not trying to put that word natural, like, petering out of the hormones for reproduction, but it does put a huge risk on people's cardiovascular system. Like I had a friend of mine in school who had a complete hysterectomy at age 18, so they could feel more in line with themselves and do what they needed to do in life. Lord and behold, though, that happened prior to us like really, really in the medical community understanding the value of estrogen and the hormones that are produced by having our monthly cycle. So
Mhm.
yeah, that's interesting, isn't it?
Yeah, there is a natural process, but it's naturally supposed to work all together. So then
Mm-hmm.
when you start removing pieces of that whole system, you have to kind of expect there to be some sort of chain reaction
Mm-hmm.
and cause and effect from what we've done.
Or even, I hear my older patients talk about, God, I just have this belly weight, da 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 da. Well, adipose tissue actually produces estrogen, and we can argue all day about BMI. I'm not really interested in that. I'm more interested in the fact that like women need to produce a little bit of estrogen, and like that's that body compensation that you were talking about. It's like, the ovaries kind of peter out. They still produce a smidge, but not nearly as much as when we're in our prime for reproduction. And so the adipose builds up, and plus additive factor osteoporosis risk goes up as we age too. And if we have a little more cushion on our bones, we actually decrease the risk of fracturing our hips, for example, which is
Right.
hugely problematic in older women. I was just
Yeah,
having this conversation with a patient and she's just like so negative about it. And I'm like, you're not hugely, I don't see weight as like a huge problem until it is a huge problem. But it takes a lot for me to like build that up. You know, I'm not into like the shaming because of someone's a number that was never meant to be used the way that medicine is even using BMI.
exactly. And so blood pressure is another one of those pieces that um, the the medicine as we know it now used to have a parameter of when you reach here, you're at a high blood pressure. And so you need to, maybe start taking some statin or watching your cholesterol intake, don't salt your food, don't eat fats, all of these ideas and philosophies.
Mhm.
And but now we suddenly have a bigger cardiovascular or a bigger high blood pressure problem in the United States, when actually what was done was they just widened those parameters a little bit that included a whole other group of dystolic and systolic numbers. So
Mhm.
now you have a greater number of people impacted, but this piece changed, not the issue. You just extended the parameters. So blood pressure and what causes that blood pressure in the heart?
Oh, I wanted to talk about that, like the risk factors for cardiovascular disease in general. And just so people have a conceptualization, the number one cause of death in the United States in 2019 was cardiovascular disease, which for the most part is totally preventable. Um,
Absolutely.
so some of the risk factors include inflammation of the blood vessels. And one of my
Inflammation.
favorite things to talk about with people is diabetes type 2. When a
Mhm.
person has out of control blood glucose levels, and this is from a mentor of mine that she talks about, it's like battery acid in the blood vessels. And that does
Mm,
not sound good in my brain, the visual I get. It's very
right.
sensitive tissue in there. And the smartest thing our body can do is actually to produce that plaque buildup that's so bad for us. But if we think about it, that's that compensatory mechanism. We have something that's damaging our body. So we have a wound in our blood vessel, essentially. Let's
Mhm.
put a bandage on it, and that's the plaque.
Yes.
So that's really interesting. And not enough vegetables is a huge one. Like we in the United States we're meat and potatoes kind of culture. I grew up eating that as well, but I have a deep fond love for vegetables. Broccoli as a kid, people were like, you're weirdo, but I'll take it.
Yeah.
Vegetables are huge, and we'll get into that in a little bit, talking about
Mhm.
why veggies are important as far as like what they contain, fiber and potassium being two big components. And the other one that I thought was really interesting that I hadn't really like brought full circle was environmental heavy metal exposure, such as lead
Yeah.
and
Mhm.
excessive iron. If someone, for example, has undiagnosed hemochromatosis, which is like excessive amount of iron, and we've all seen rusted iron. And if we have that in our body, that's oxidizing our system, which leads
Yeah.
to inflammation and irritation of our blood vessels, etc. And,
Yes.
and the one last piece that kind of ties into all of this too is, for those of us that are a little more savvy to methylation cycle issues, there's a specific lab that some of your doctors, if you have heart disease, might run called homocysteine. And that's part of the methylation cycle. We're not going to dig into that too much today, but when you have too high of that, it's inflammatory on your cardiovascular system. So
Mhm.
again, here we go. What is the main cause of cardiovascular disease? Inflammation.
Inflammation.
Yeah.
Yep. And so that brings into play, you have anti-inflammatories that can be prescribed, or you have natural anti-inflammatories, which one is reducing the inflammatory pieces that you're putting into you, which the number one inflammatory is sugar.
Hmm. As
And
much as we all love it, and
I know,
cookies are
I
my weakness.
know.
Love me a good cookie, and I'm really curious about checking people's fasting insulin levels, because I was just reading in a book actually about salt, which I know we keep bringing up salt. We'll have to do a whole talk on salt one
Love
day.
the salt.
Uh-huh. Fasting insulin should be less than 5. And most people in the United States average about 8 to 10 or so. And so, that's a risk factor for having insulin resistance later in life, which leads to type 2 diabetes. So it just, how can we prevent and, really full circle with allowing ourselves to be able to enjoy our lives too, have your cake and eat it too. I'm all about trying to troubleshoot to make that be possible.
Exactly. And, inflammation has its good piece.
Mhm.
When I worked in a physical therapy clinic where I ran a red light laser therapy. And part of my training for that was learning about inflammatory response.
Mhm.
And it's one thing for when you have an acute injury, you run into something and your finger swells up, you jam your finger or whatever. Well, that's the body's response to an injury. Okay, we're going to flood the area, we're going to protect the area, and we're going to bring in nutrients because the body is scanning all the time for what does it need here, what does it need there. Cells are calling out for help. And so you have this inflammation at the location of your injury.
Mhm.
That's bringing in nutrients. That part's all well and great.
Mhm.
Now, if you stay in a heightened response of inflammation, what does that do? You're
Mhm.
just you're just keeping that clock turning and creating a very stressful situation, which then you have, like you said, the toxins. And unfortunately, whatever, that's how it is. That's what fat stores are full of
Mhm.
toxins.
Yeah.
And those toxins were from overconsumed, underutilized carbohydrates.
Yeah. Yeah. Plays a big role. Absolutely. And just to touch on something you had mentioned, inflammation, exactly, we need it, and it's not about suppressing it and taking all the NSAIDs or ibuprofen or Tylenol that we want. Sometimes that's necessary, and I do everything within my power to help my clients and patients not need to take that. And sometimes getting sleep is a little more important than your shoulder hurting and you just need to let that go. But what does that do to the actual inflammation cascade? It just stops it.
Mhm.
It doesn't it's a bandage on the problem rather than like, okay, what are we doing in our lifestyle that's creating this inflammation? As much as I love a good piece of barbecue, I'm not eating barbecue 3 times a week, because
Right?
that, another piece of the inflammation is like rancid and oxidized fats and oils, which
Yep.
oftentimes are from animals. I'm not against eating animal products at all. I'm
Mhm.
just all about moderation in the way of
Right.
like the way we consume and keeping variety up, including
Right.
lots of vegetables. And I feel
Uh-huh.
like the more vegetables you eat, it kind of balances out some of those like choices that are a little harder on our bodies, um, like eating barbecue, you know?
Right. Well, those acrylamides and everything that
Mhm.
those that's a big C word that you don't want to get into. But talking about vegetables, because as a nutritionist, I love the food aspect.
Mhm.
And you had mentioned potassium, and one of the amazing things about the heart is that it's not just a muscle. It's not just, moving oxygenated blood in and throughout your body, but it's also um, an electrical piece.
Mhm.
And potassium is one of those critical pieces to that electrical system working, and how running an EKG, you can see where there's been some damage to the heart because it's not fully uh, there's baseline readings that there should be, and
Mhm.
when it's not there, you can tell when there's been damage to the heart. And when you ask somebody after reading their EKG, oh, when did you have a heart attack? I didn't have a heart attack. Well, you had some sort of cardiovascular trauma, cardio trauma,
Mhm.
that has shut down a piece of your heart. So
Mhm.
what do you how does potassium, vegetables, all of that great stuff?
Yeah, potassium is one of our main electrolytes in our body, and it's the most abundant intracellular cation. So, what does that mean? That means a positive ion. So, going back to chemistry, if any of you guys have had chemistry class, so the way that potassium is written is from the periodic table, and it's K plus, which means that's a positive ion, and it's located primarily in our cells. And so when we have, for example, our heart contraction or muscle contraction, because we use potassium throughout the entire body, we have something called the potassium sodium pumps. So sodium gets pumped in, potassium gets pumped out, and that is what creates the contraction. In addition to like calcium, which is another cation, and magnesium, again, another positive, just like sodium. All these are positive ions, and they help with the contraction and relaxation. And in the cardiovascular system, we need all four of those in a certain ratio in order for like optimal contraction and relaxation. And so a lot of people experience potassium deficiency symptoms, and they're super vague: fatigue, muscle weakness. What else do we have here? Edema. Yep, that's another one. Cardiac arrhythmias, which is like when your heart rate kind of gets like a little crazy. Hypertension. And then one that's like POTS. I'm not sure if you guys have heard about POTS, postural orthostatic tachycardia syndrome. That's like all the rage right now within the alternative medicine community. But that's like, it's an aspect of that is standing up too quickly, quote unquote. And you kind of feel like, oh, feel a little woozy from that. And that plays a role with electrolyte balance. And I don't know if it's just potassium that's a problem, or if the ratio of all four of those is kind of a little wonky, because most Americans, believe it or not, don't get enough calcium, don't get enough magnesium, eat way too much sodium, and the wrong kinds of sodium too, in my opinion. And then significantly not enough vegetables. And I'm sorry, but 1 cup of iceberg lettuce a day is significantly inadequate. Just we're gonna put that there.
And that's exactly the misdiagnosis that started me down the path of holistic care. Was my grandfather he started suffering from edema, and so they put him on a diuretic and not just limit your sodium, zero sodium. We were all on, as a child, my mom and my grandpa, 0 sodium in all things. And so gave him a diuretic, 0 sodium, and no potassium to go along with it. And what did he do? He stood up, passed out, emergency room trip, hospitalization for a week, end up with a pulmonologist that actually, so then you have to call in the specialist to undo what had been wrongly done over here. And that's just another piece of it with the calcium, where it's only thought to be part of bone structure. And like I said, the body is always scanning. What do the cells need? What do the cells need? If you're not getting it in your diet, you have to get it somewhere. And we can talk supplements a different time. But chances are, unless you're going to do a micronutrient analysis of every food product, you're not going to get it from all of your food. You have to supplement. And your calcium stores are only in, what you've already put in your body. And once your body starts pulling them, your body needs calcium for a lot of functions.
A lot.
So as we age, we're not only weakening our skeletal structure, but also our electrolyte functioning and everything, your parasympathetic nervous system, all of these things that require calcium. If you're not putting it in you, you're gonna run out. And then we have all of these different subjects, from calcium and sodium and magnesium, potassium, critical aspects to overall health.
And I do want to mention, because supplementation of potassium is a little bit tricky and honestly dangerous. In your grandfather's example, he was taking a diuretic. That is potassium wasting in its nature. So extra losing of potassium, in addition to probably not getting enough potassium already from the food he's consuming, and that's probably for a variety of reasons, including our soils deplete. But I do not recommend taking a potassium supplement unless you were under the guidance of a licensed healthcare practitioner that understands the dangers, because you can send yourself into like arrhythmias, and you don't want that.
Sure.
So like everything is in a specific balance and ratio in the body. And
Yes.
if you're going to want potassium, pick some vegetables up at the local grocery store. That's a much better way to supplement. And it's, again, soil depletion or not, that's a much safer way to do it DIY rather than hiring a healthcare professional.
Right. And I love that avocados are so high in potassium.
They're the number one highest, actually, way higher than bananas. Bananas aren't even in the top 6.
No, and they're so full of sugar, it's sad.
And they also don't even grow in North America. That's my other problem with, we're having food shipped over from a completely different continent. As good as bananas may or may not be, there's only like a couple times a year that I even personally crave them. Just like they're kind of like that weird, like kind of like papaya and pineapple. They have that weird enzyme feeling in my mouth. And tomatoes are actually the second highest. And good thing we're kind of popping over tomato season here in a few months.
Well, it was funny. I was in the grocery store yesterday and I saw they had corn on the cob, and I'm like,
from where?
From where is this coming from? And why would you buy it?
South America?
Because it's not, one, it's not local. 2, there's nowhere in the United States that would be harvesting corn at this time. So it's clearly been shipped from somewhere. How old it?
Yeah. And, with that too, so the top 6 I wrote down because I just wanted people to see: avocados, tomatoes, apricots, potatoes with skin. So if you're going to eat potatoes, which I'm a huge fan of, regardless of sugar content, but if you eat them with the skin, that's where the nutrients are, and really the fiber too that helps to balance out the starch that's in the potato. And cantaloupe. So we're kind of coming into summer. And papaya, again, like kind of like bananas. I have this weird thing about tropical fruits. I don't live in a tropical climate, so I don't really like to eat tropical fruits, and I don't really encourage my clients and patients to do so unless they're really craving it. And I definitely want people to listen to what their body is asking for, because there could be something beyond, my personal understanding of like how I think we should eat, right? Intuitive eating is my first style of approach. But
yay,
the bananas aren't on there, folks.
No, bananas are not on there. And I love that, all of those things are easily grown. I mean, at least here in Colorado where we are, we're not going to be growing papayas, but we can grow cantaloupe if we start soon enough over here. We can grow cantaloupe, we can grow tomatoes. Avocados, maybe inside, that's questionable.
They come from Cali, that's not too far.
But yeah.
And apricots, if we're lucky, because I feel like it's like every 6, 7, 8 years that we actually get a good apricot harvest, because the frost, they bloom first, one of the first blooming seasonal trees. And then if we get a late frost, they kill all the flowers, which is sad, but that's, the orchard growers know that this is the thing. And so they don't lean heavily on the apricots.
Right.
And if you've never had a fresh apricot, I highly encourage you to venture out and find one, because it's a game changer. They are
so good. So good. And those are all really good forms of, well, maybe not all, but good fibers for sure. And, I'm since I help a lot of people with reducing their carbohydrate intake, we're putting rutabagas in for potatoes. We'll have to see where rutabagas fall in that line too.
Let me see if they are on. I'm a huge fan of rutabaga. That's been my favorite vegetable this year, actually.
Because they have the same structural integrity of a potato, and a lot of people will substitute cauliflower.
Yeah.
And cauliflower just kind of gets mushy after a while. So I
don't see it on this list in this book that I'm using.
Darn.
That does not mean that it's not, right? Like rutabaga, like parsnips, are vegetables that don't really have a standard American place in our diet.
Which is unfortunate.
It's so unfortunate. And I love, rutabaga. Anyway,
yay,
side note.
Team rutabaga.
So I kind of wanted to, I have found that most of my clients, and I'm sure Carolyn, maybe you found this as well, they don't really know the difference between systolic and diastolic blood pressure, the top and the bottom number of a blood pressure.
Right.
So I wanted to just chat about that so people could understand. And so from what I understand is the physiology happens this way. Top number is the blood being pumped to your system, systolic system. So the heart is opening up, contracting, and sending blood through the aorta into the rest of the body. Whereas the bottom number, the diastolic, the heart's relaxed, the ventricles are filling. And so that's that, like the lub dub. Lub is systolic, right. Dub is diastolic. Mm-hmm. And, you know, it depends on who you speak with as to whether or not the top number is more important than the bottom, but it really seems like to me that the top number, if that gets really, really high, that is very concerning. And we're talking really high, like over 200, but technically what's considered high blood pressure, and this is where you were going in the beginning of like, these numbers have really been tightened up. And, you know, working with a healthcare practitioner that understands these nuances, because what I would like to see in an 85-year-old client of mine might not be the same as what I would want to see in like a 40-year-old client of mine.
Yes, age does have a
It really does. And we don't want to put like crazy expectations on our 85-year-old. Like I'm thinking of my grandma here, and her blood pressure runs about 150/80. And I think for her age, that's pretty good. I'm okay with that. Even though the standard is if you have 2 or more blood pressure readings over 140/90, greater than or equal to 140/90, that is considered a diagnosis, how you diagnose hypertension. Now, what's causing that hypertension? You just woke up one day and all of a sudden you have hypertension? No, that's not how.
Nothing happens overnight.
No.
There's always some a tip off here, there, or another over time. And one of the things that you said, so the descending aortic, it's on the left side of the heart itself, that if that gets clogged, if you start to see those higher number readings, that particular one, there should be a blood clot develop, or something in, you know, a full-on blockage where they would want to go in and put a stent in or something. That is the most, hold on. I love water. That's one of the Widowmaker, one of those old wives' tales.
Oh yeah, it's the lad. That's the Widowmaker.
Yeah.
The most common place we have heart attacks. And I'm curious if it's in women as well, because I know women have like a different presentation for heart attacks. It's usually the posterior artery of the of the heart rather than like the anterior one. Oh, that is left anterior descending.
Thank you. Anterior. That was the word. Yes. You know, and just the structure that is soft tissue. You know, selenium and essential fatty acids, they're, you know, with our good, and avocados is another perfect place for those healthy fats to nourish the body and help it get what it needs to have.
Yeah. And so I kind of bringing this back to salt again. Most of you have maybe heard of the DASH diet, the dietary approach to stopping hypertension.
Right.
In my findings, like only about 30% of people that have hypertension are actually salt sensitive. And I would venture to bet that there might be, if we open up that can of worms, we might find some other pieces with the electrolytes that we spoke about earlier contributing there. But if you really look at that, it's still very much the standard American diet, in that there's not still a bunch of it's less canned foods, which is a source of potential lead and cadmium. And we talked about that being a risk factor. And it's still higher in sodium, but it's like the processed foods. It's very processed foods.
Oh, sure. Nitrites and nitrates, those are some other big
inflammatory causers.
Yeah. And, you know, a lot of it, like you said, relaxing. And the whole body, using breath as a way to calm and relax and bring you out of that high stress zone that, you know, your body can only act optimally when it's getting full oxygenated blood supply throughout, and you're in a calm mental state, because when you start bringing up your anxieties, you automatically tense and you start breathing faster, and that's gonna, it's a whole chain reaction. But even finding some self-care methods can really help with the whole cardiovascular system.
Absolutely. And I had the pleasure of getting to work with a mentor of mine that his main focus for his entire 30 years that he's been in practice has been breath work. And he has seen some pretty cool things with autoimmunity, but also with hypertension. And there's a lot of good data showing that people that have hypertension, especially when medications and other things don't work, that oftentimes those people are breath holders. They have low vagal tone. Vagal tone is that cranial nerve that runs down from the cranium through the neck and innervates a lot of stuff in our guts.
In our digestive system, yeah.
Our parasympathetic, rest and digest. And so what that does is it actually strengthens the contraction of the heart. So it makes the heart work more efficiently while reducing the number of beats. So you can even tell just the intonation of my voice, like I'm already feeling a little more relaxed, just kind of changing the tone of my voice. And I didn't really dig into this as much as I would have liked to today, but the heart rate variability is huge. And there's a lot of really good information coming out about people that can take themselves from those really high stress moments and bring themselves down. The quicker they can bring themselves down into like a more relaxed, calmer, lower heart rate, they have the ability to live longer and have more, less negative health outcomes, which is really fascinating. And like, we are self-regulating. Like we have this ability. Our breath is free. Why not play with it?
Oxygen is free.
The carbon dioxide,
the whole self-care, and when you mentioned lead and toxins, that goes along with our environment, not lead or air pollution environment necessarily, but our surroundings and who we some of the mindset work that I know I do, and I'm sure you probably work with your patients this way, is kind of getting to know your patient, my clients, and saying, so how is family life? What are some of these work stresses? I can eat really good when I'm at home, but when I go to work, I just stress out. And so then I just have a drawer full of goodies over here, So there's those choices, but that's it. It's a choice. And one of the, you can choose to get upset, or you can choose to deal with it and breathe and let it go. One of the best examples I ever found was, you're having a toddler breakdown at home, and you're in the middle of some, I don't know how many times I've told you, and the phone rings, you're, hi, how you doing? And how you can just totally change your reaction when you want to. And as goes, those stressors, those toxins, the toxic people, the toxic whatever, that's a choice. And if there are some people that are causing you stress, that you're in a toxic relationship with, that may be one of those things that for your heart's health, you need to have a little separation from, or, deal with it. However, I'm not going to give life advice, but it's one of the things that affects overall health.
Holistic approach. And sometimes work in that job that pays super well, not in line with what your purpose is. You may not even know what your values and your purpose in life are, but it pays really well, right? So I'm making enough money and I really hate my job, and this customer yelled at me, and like my boss is fine, and I sit in front of a computer all day, and it's again not in line with their values, but they don't even realize that is very hard on your system. That's the holistic approach. And just like you were saying, Carolyn, like if you're in a marriage with someone that's abusive, whether it's verbally, financially, emotionally, physically, all the same in my mind, abusive. And what about, that friend of yours that you hang out with and you guys always drink a little too much? maybe that's fine from time to time, but do
Mhm.
you need to be doing it every single day, multiple times a week even? Alcohol is a huge component to high blood pressure. And, whether it's the friend egging you on or, whatever, there's still a choice there that happens. And
Right.
again, not against alcohol. I'm just, saying that this is moderate to heavy drinking of alcohol, which for women or smaller sized bodies, it's 2 drinks per day. And those are measured out in specific amounts, not like drinks, like drinks. Um,
Not
oh,
the Super Bowl margarita.
no, that's probably a few beverages, let's be honest here. And for dudes or larger bodied individuals, that's like three drinks. And I don't recommend drinking heavily, occasionally having a beer, occasionally having a glass of wine, you know, more power to you. You do you, and sometimes that's necessary, but check your relationship with alcohol. And, are you using it as a coping mechanism? Are you taking a space when you get home after that customer yelled at you and just really ripped you a new one at work?
Right.
Or are you just like coming home and grabbing that bottle first thing? Like, take that space and maybe help process some of the emotions. And, you might find that, oh, I don't really need to have this, or I don't really want this anymore because I gave myself a chance. There's a
Yeah.
cat looking in my window
Oh,
from outside.
hello, Kat. What is it, do you know that that alcohol relationship to high blood pressure?
Yeah, so it's not ethyl alcohol itself, which is the active component of drinking. It's the breakdown product. So once it's been processed through your liver,
Liver.
what is it called? An ethyl aldehyde, I believe. That is super hard on our body. What does it cause? Inflammation.
Inflammation.
Inflammation. And no amount of red wine with the flavonoids that are good for your heart is going to cover that up. Alcohol is still alcohol, period, regardless of the flavor, variety, texture, whatever.
Yes,
Biodynamic, organic, I don't care. It's still alcohol.
right. And not to bring up an old thing, but it's also got gluten in it. And it's also a high sugar. So you're dealing with, a whole lot of other things going on, plus
Multiple
the high blood
inflammatory
pressure
things.
situation.
Yeah, yeah.
Yeah.
And, with alcohol often comes dehydration, or even not. Just like, most of my clients drink 3 cups of water a day. And that's like
Uh-huh.
being generous. And so my thing is, you wake up, you have 2 glasses, which are 16 ounces of water total, and you drink that first thing. No coffee, no tea, no soda. You wake up, you go pee, you have water. That's
Right.
that's what you do. That's what I'm recommending to people, to like, then you have 2 of your half of your fluid ounces of water per day by your body weight in water per day.
All right. Yeah. And then when you add your caffeinated something, you can pick up another couple glasses of water to go along with it because of
Yeah.
what caffeine does. And so how caffeine is used as a stimulant for a number of people, and those stimulants can also affect the heart.
Increased blood pressure. Yeah.
Uh-huh.
Yeah,
Yeah.
absolutely. And like, I
So
don't know if anybody else feels this way, but if I have a little too much coffee, that coffee jitters, take your pulse. I bet your pulse is over 100. That's
sure,
fast. Like,
sure.
that's that anxiety, jittery feeling. And some people can really thrive on it. And I can sometimes, but I tend to run on high anyway. So I don't really
Mhm.
need that extra
Uh,
push over the edge with the coffee.
Right, right. And
Mhm.
and there's always the metabolism piece of it too. Metabolism of anything, alcohol, caffeine, sugars, food in general. It's all there's so many variables that are involved, and that's why I love working with people, because they're all so different. There is not one particular anything. I love doing what we do. Um, it's so fascinating, and I love learning and helping people. So
Yeah,
it's
we get to play. It's like
a good deal.
more finesse, this holistic approach. It's like, okay, well, you don't smoke cigarettes, which you could be getting cadmium, and you drink enough water, and so okay, what else is going on here that could be contributing to hypertension? And I actually have a client right now who has this very in my opinion, bizarre, and like the cardio specialists don't really know what to do with her, and she's taking a medication that I've never heard of someone taking PRN, which is as needed for high blood pressure. There's no consistent high blood pressure. It's just like it happens. And honestly, I think it's stress. She's had everything ruled out. So that makes me feel good. Nothing serious
Right.
is going on. She's been tested for even really rare conditions that, happen very infrequently. Um, Everything's fine. So then what is
Good.
it? Stress. And I think also, to bring some of that energetics, because you talked about the electrical system of our heart and EKGs, and people want to say that we're not electrical beings. That's baloney. We totally are. That's how our body functions. This is why grounding, standing on the earth, is helpful for us to
Yes.
reduce stress,
Yes.
decreases some of those negative ions, and helps to just like balance the body out. And bringing love and emotions into it. This person has had a hard time with like romantic relationships. She's a caregiver. She gives above and beyond. And like oftentimes with caregivers, moms, single parents, their self is on the furthest
Self-care.
back burner
Yeah.
possible, like
Yep.
not even on
Yep.
oftentimes. And I found
Mm.
that to be the case with her. And it's just like,
Mhm.
we got to work with that. And the other piece with the mental emotional stuff is bringing in the spiritual component, and that's like what we were talking about with like the jobs and the relationships. If you're living with someone that's just like crushing you, that's soul crushing.
Mhm.
That's not great either. Like,
Right.
we want to help grow and sprout and like, continue evolving throughout life rather than just being crushed into the ground.
Yeah, I really love the thoughts of gratitude journals and showing gratitude for, if you're struggling, find something to be grateful for, and that struggle is not going to seem so bad right now.
Right.
And I really think that's what I love. Part of my magic morning is spending some gratitude time and just writing it out. The random things that you'll come to your mind. Um, I think, and the intentionality of it,
Mhm.
I think is really helpful for a lot of people
Yeah.
in that stressful situation, because it totally that uses a different side of your brain.
Mhm.
You're just you're in a different place when you're in a state of gratitude. So it I really like that part too.
You're seeing goodness in life, even when it's the darkest hour for you. Like it's so much easier to kind of see, okay, this really sucks, and I have a nice view. So at least I have a nice view while this is hard, or whatever the gratitude is. Just being grateful for something.
Hmm.
I agree with you, Carolyn, that makes a huge difference, and just that one shift can be enough to kind of bring people up out of the dumps,
Yeah,
with other things too. But just that shift
sure.
is like, it's pretty magical.
Absolutely. I'm so excited to get into the garden. I love gardening in my bare feet. Bringing up some of these, putting some of these seeds into the ground and bringing forth some cantaloupe and tomatoes. And um,
Yeah.
I love this time of year.
Spring, yeah, everything's
It
kind
makes my heart happy.
of. Me too.
Yeah.
So I feel like that's pretty good on, general heart stuff. What should we talk about in March?
Ooh,
I was
let's
like trying to
see.
ponder this. I was like, okay, we've got St. Patrick's Day. That's green. What's green that we could talk about?
We could always talk veggies. We could always talk springtime might not be a bad reproduction time. If
Ooh,
that's,
I like that idea. Okay. Yeah.
start seeing some new youngins in the fields, and it's
Oh,
kind
the
of the
baby
natural
cows.
course.
Yes. Ooh, they're so cute when they
Yeah.
run around. Okay.
Yeah.
That sounds good. Let's get into like some basics of male and female reproduction. And yeah, there's a lot there, even beyond the basics, because again, like the environmental stuff plays a interesting role. Sure does.
Yeah. Yeah. So we can talk hormones and reproduction.
Okay, that sounds good. All right. Well, we'll
All
see you
right.
next time.